Most people don't see the connection all the time between public decision-making, especially around things like infrastructure or urban planning, as having something to do with our health. But what we know is that health is actually how we live, work, and play. Health has to do with our opportunities to be safe, to get around, to walk, to get to the grocery store, to actually have access to educational opportunity, access to good jobs. All of those things actually add up in a system that creates a healthy community, which gives people and families the opportunity to thrive and be healthy. University Avenue connects downtown Minneapolis with downtown St. Paul, and it is the site of our second build-out of our regional transit system.
This is Victoria, and one of the reasons we're meeting here is because this is one of the stations that was not in the original map. And if it hadn't been here, then people who live near here would have had a really long walk to get to a station to actually make use of this system.
As the planning process unfolded, it began to be clear to the community that there were not going to be stops in the most racially diverse, low-income communities along the Central Corridor.
A great number of the residents, especially low-income people of color, are living in the eastern end of the corridor, and a great deal of the healthy food options and the healthcare facilities that are available within the corridor are farther on the western end. So the connection via transit is going to be really essential.
We've worked hard to make sure that the stops were put in place so that way it would be a benefit to our community. To not provide adequate stops here would really defeat the purpose and access for the people that live right here in the community.
If you're going to build this system, you got to build it right. You got to put the stations where they need to be, and I think that's a lesson for anyone building a system. Include people on the ground floor, and community organizations need to get involved, stay involved, because we can make a difference and we can actually build a system the way it's supposed to be built.
I own a business on the avenue, but I also live 2 blocks from here. So as a business owner, as a resident, I see it's a benefit for overall business and the community.
And so now you've got light rail, or will have light rail in a little over a year. And the ability for people to see this as an attractive place to come to, so this becomes a destination point, not just where we want to pass through, that has the ability to raise the economic status and the health status of people that live here.
So these kinds of decisions that we make around transit or public investments or how we design our communities have everything to do with investments that we make in the future health of our children and our families and our communities.